Dr. Jeffrey Lehrman. Happy Friday. WebCME wants you to start your weekend with a win. The Clinical Connection Friday feature today is broken toes. As a podiatrist, one of the more common things I see is broken toes. And unfortunately, one of the things we see quite a bit is people that have sustained a broken toe and thought that it didn't need to be treated. The take-home message today is that most of the time, broken toes do need to be treated. And one of the things we see a lot is somebody coming in 4 weeks or 6 weeks after their injury saying, I thought this was going to go away on its own. I thought this would just get better and it still hurts. And it turns out they have a broken bone, or what might be referred to as a fractured bone. And most of the time, they do require treatment to get better. So just to give you a simple example of what happens when a bone breaks, we'll take a look at this sort of crude picture of a broken bone. So let's say you have a normal bone, which would look like this. And what we might call a good kind of fracture is if you get a crack through the bone like that. And if the two pieces stay together, that's what we would refer to as a better type of fracture. Those are easier to treat. The other example would be if you break that bone and if the pieces move and they come far apart from each other, they need to be put back together. And a broken toe can have either type of this fracture. If the break is of this nature, where the two pieces stay together, it still needs to be treated, and most of the time what it needs is immobilization. When you get that crack through the bone, the way it heals is for new bone cells to come in and to fill that crack. Those new bone cells are fragile and immature, and if there's any motion at the healing site, they can just break apart and not stick. In order for them to stick, the bone needs to be held as perfectly still as possible, which is why if you break an arm or a leg, you get a cast. Well, we can't cast a toe. It wouldn't fit. It wouldn't work around a little toe. So what we normally do is two things. We tape the broken toe to the toe next to it, which means it cannot bend like that if it's taped to the toe next to it. And the other thing we can do is give the patient a rigid bottom shoe. Because if you take a step in a normal shoe, it will bend this way. But if it's a rigid sole shoe, a shoe with a wooden plank, it doesn't bend. So we can immobilize the toe from bending that way by taping it to the toe next to it. And we can immobilize it from bending this way with a rigid sole shoe. Now, if it's the other type of fracture, where the two pieces move, those two pieces need to be put back together. And that can often be accomplished by setting the fracture, which is often referred to as a closed reduction, which is done by numbing the toe and then manipulating that piece back where it belongs. The only way to really know if it's the type of fracture where the two pieces have stayed together versus the type of fracture where the two pieces have moved is with an X-ray. And an X-ray would allow us to determine if it's a non-displaced, meaning the two pieces are together, versus a displaced fracture where the pieces have moved. And if it is displaced, most of the time we can put them back together with that manipulation. In rare circumstances, it may even require surgery. And that concludes this week's win. We hope this clinical connection will enhance your practice. Be sure to send us your questions and follow us on Facebook, Twitter, or LinkedIn. Enjoy what I hope for you will be a safe and relaxing weekend.